Let's go ahead and touch on the topic of personal injury marketing to the medical profession, specifically the general practitioner. Let's touch on some of these major points here and go into the pros and cons. These are major points relative to marketing to the medical profession for personal injury cases. Okay, first of all, you want to pay attention to who the target market is. So we're going to pay attention to the demographics, psychographics, geographic, psychographic barriers. So that's when you're picking what we call the A, B, or C, or excuse me, not the A, B, or C, but the general practitioners. So which of the medical providers would be the hierarchy of who to refer? Who would I pick first? Well, the first person, in other words, if you followed the personal injury patient, where do they go first? Only about 15% go to the hospital. I don't know if you know that or not. So the majority of people do not go to the hospital. So when we go to the hospital, so if we look at the hospital, we're talking about from an emergency room doctor standpoint. And I'm going to put that on hold right now because that's its own unique messaging. So let me leave that alone. And it's a smaller percentage, but I've given many presentations to emergency room doctors. The next category that most of them will go to is their general practitioner. By far and away, it's their local GP where the vast majority of these patients go to. Remember, you'll have more people go to a general practitioner than the emergency room or to an attorney or to a chiropractor. The general practitioner gets a lot of personal injury cases. And they'll go there first. They typically will go to the GP within a few days to a week or two after the accident for pain pills, muscle relaxers, things like that. So that is the first place to go. Now, the third category would be the neurosurgeon or the orthopedic surgeon, but let's leave those alone too, because that's its own message. And it's a smaller percentage also. In other words, the vast majority of these auto injuries are not going to be going to a neurosurgeon or an orthopedic surgeon. So where in the medical profession is the best target market to pick up personal injury, soft tissue? Now I'm talking about low impact soft tissue spinal injury cases. So we're very specific. So where is that? It's your local general practitioner. That's who's getting the vast majority of cases first. They'll go to there before anybody else, and they'll go there before the attorney.